Hello, everyone. My name is Lasha Scott. I am the CEO and president of Scott Center for Observation, Treatment, and Transition. We're gonna give me a second here. I'm gonna have to re-upload on two of our destinations here, so just give me a moment. Okay, give me a second here. Just want to make sure that it is live streaming to our other destinations. All right, so we are going to start this over. I am LaSharday Scott, the CEO and president for Scott Center for Observation, Treatment, and Transition. And today I just wanted to do an overview, be that school is getting ready to start back. We want to make sure that sickle cell patients and families are at least knowledgeable for some of the information that I'm going to do an overview of today. Hello, Dr. Shrunk. Thanks for joining. So, we're going to go ahead and tap in. Disclaimer, this presentation is for educational purposes only, and it does not constitute legal advice. It is recommended that you seek legal counsel for specific matters. Like I said, this is just an overview for information for families. I just wanted to let you know what is available out there. So if you have any questions, I suggest that you seek legal counsel. So some of the learning objectives you'll get today is what is a 504 plan? What is an individualized education plan, better known as IEP? What is an IDEA, which is Individuals with Disability Education? American Disability Act, which you've probably heard of ADA, and Family and Medical Leave Act, which is better known as FMLA. So you're going to get a lot of information pertaining to these things here. Hey, Deonde, how you doing? Thanks for joining. So, what is a 504 plan? A 504 plan requires that a child with special healthcare needs, such as sickle cell or any other health disparity, it limits one or more major life functions to be provided with ways to participate in general education programs. So, for example, in a 504 plan, students and families may develop a special request to the school, such as like frequent bathroom breaks. We know that sickle cell patients, the weather plays a role in how their sickle cell may be impacted. So make sure that they have extra layers of clothing and things of that sort. So this 504 plan will help with accommodations. You will sit down with your social worker at the school to set up this 504 plan to ensure that your child is getting their accommodations met. Prime example, if there's a fire drill, you want to make sure that that child has a coat. And I know in real circumstances, it's probably hard to get a coat, but be that it's a drill, we just want to make sure that the child is receiving accommodations so that their health is not impacted. And the schools wouldn't know unless you tell them. So this is something we want to make sure that we are having these conversations with the social worker, the principal, and the teachers. A 504 plan is administrated in the schools that receive federal funds, so public schools, and is a written document that outlines reasonable accommodations For individuals with disability, the 504 plan ensures that a child with sickle cell disease has equal access and can participate fully in school activities. However, it does not outline for remedial instructions. So, where can you or who can you talk to in regards to this? You can also reach out to your community-based organization that's in your state, and to see if someone can accommodate you with some of the outlines for accommodations for sickle cell patients. So this leads us to what is an IEP. So an IEP is an individualized education plan. An individualized care plan is a written document. It can be tailored to specific healthcare needs of a student with sickle cell disease. An individualized care plan requires teachers, school nurse, the child, the family's input. Plans should include emergency contacts for any special needs that the students may have, so that basically everybody is on board. The instructions for giving pain medication, so we know sickle cell, it doesn't let us know when it's gonna show up. So we want to make sure that we know who's responsible for providing that medication and how the medication is supposed to be given. So you want to review the school district's policy statements pertaining to that, and then update care plans with the school nurse yearly. So we know things change. So we want to make sure that we are doing this yearly or whenever the child's healthcare needs change. So just so that everybody's on the same page, we want to make sure that the individualized plan is set in place. And also, in addition, so I always tell patients to have a 504 plan and an IEP because they help support one another. As I stated to you before, the 504 plan is an accommodation, but the IEP sets the tone to make sure that not only are the accommodations being met, but school wise. So we need those extra set of books. We need more time on assignments. And this is why. So it really will help the child be successful or to maintain success in school, as well as keeping that stress off if that child is in the hospital. So we just want to make sure that we have all parties involved and that everybody is aware of why the IEP and the 504 plan work hand in hand and why it's important for patients to obtain these. So I know that there's usually working with a social worker at the school, there may be a time frame. It may not happen right away, but you want to make sure that you speak with someone soon because school is back in session for some people, or it will be back in session. So you want to make sure that you set up this appointment with the school social worker, the nurse, all of these people to ensure that your child gets the help that they need. So what are Individuals with Disability Education Act? So what is this act? This act is a federal law that provides funds to states to support special education and related services for children with disabilities, administered by the Office of Special Education Programs in the U.S. In the U.S. Department of Education. So to be eligible for benefits under IDA, a student condition must impair their educational performances, and they are required special education and related services, which contain confidentiality protection for student records. So I know a lot of people do not like to have, they don't want to identify with a lot of these programs, but look past the stigma. This is really to help the child. So this any school age kid, I suggest that you look into this information to see how this best benefits your household. So now we're going to move into employment. So I know we have patients that are 16 and older that are working with sickle cell disease. So when applying for employment, you are not obligated to disclose your diagnosis to an employer when applying. It can be challenging to decide when to reveal your illness to them, but during the interview process, a knowledgeable employer can provide reasonable modifications. However, many sickle cell disease warriors discover the best time to request fine adjustments is after a formal job offer. I'm really not opposed to that. Although people should not discriminate, we know that unfortunately people discriminate. So when you're applying to these jobs, you do not have to disclose your medical diagnosis. But once you've gotten the offer and these things, I will highly suggest that you mention, you may need some accommodations. So recommendations and accommodations with the employer consist of preventative measures to keep you healthy at work. We want to make sure that there's reasonable accommodations to you, to your work environment and schedule. So, we just want to make sure, like, when we're requesting these things, you may have to work nights because your medication has you up on, have your sleeping pattern off. So we just want to make sure that the employer is aware of some of these things. A guaranteed parking space, because we know patients sometimes it's hard for them to do long walks. So if it's best for you to have a parking space closer up, avoiding rush hour by working flexible hours, ensuring access to water and bathroom breaks, permitting hospital and medical appointments as paid time off, or just allowing flexibility to be able to do these things. Adjusting policy for sickness absences. We know some jobs, they have a 3-day absence and then you may be terminated or written up. But sickle cell has no alert that allows for you to plan ahead of time. So just making sure that the employer is aware that you are not just calling off. So we want to make sure that those accommodations are set in place. Allowing you to work from home. Now we know COVID has changed a lot of things. So a lot of people are able to kind of do a hybrid situation. So maybe that may be an option for you. Modifying uniforms to enable warm and comfortable clothing. As I stated earlier, sickle cell patients sometimes have to dress in layers depending on where you are in the United States. I know here in the Midwest, the weather, you can get 3 different types of weather in one day. So just being able to layer your clothing. Making sure deadlines and and that there's flexibility to minimize the stress in sickle cell patients. So we want employers to know that stress can cause, a sickle cell crisis. So we just want to make sure that we are supporting, or these employers should be supporting patients that are in the workforce. And then a last accommodation that I'm going to say is ensuring the workplace is warm by adjusting temperatures, providing heaters, a workstation, and you may even need a cool station depending on what type of work you're doing. But I say all of this to say, as a warrior, you know your limitations. So when applying to these jobs, you have to really think realistically, is this a job that you can actually do? And this is not to make one feel shamed or any of those things, but we have to have realistic goals when applying for jobs, or just being knowledgeable of like what our limitations are. So I say all of that to say you can still work if your body allows you to do so, but just make sure that you're mindful in the recommendations and accommodations with your employer and you have those conversations. So, what is the American Disability Act? The ADA prohibits discrimination against people with disabilities in many areas, including employment. It protects the employees during the application, hiring, promotion, and compensation and training. The law requires employers to provide reasonable accommodations. So I just provided you with a huge list of accommodations um, for applicants and employees with disabilities. The specific accommodations fall into three categories. So you have changes to the application process, modifications of physical work environment or how the job performed, enabling equal access to benefits of employment, so cafeterias, lounges, etc. The ADA also makes it illegal for employees to ask applicants whether they have a disability or how severe this disability is. And also employers must keep the medical information confidential, including requests for reasonable accommodation. So no one should know your business in your work environment. So everything should be confidential as you have these discussions with your employer, as they, ensure that you're getting what you need to be successful in this job. So, what is the Family and Medical Leave Act? So, FMLA. Um, this is one that I think a lot of people are not. I know a lot of jobs have certain requirements in order for you to apply for FMLA, but it's definitely something you want to make sure you as a parent apply for if you're working. And if you are a person living with sickle cell and working, this is something that you want to make sure that you are privy to. So the FMLA allows eligible employees to take up to 12 weeks off yearly for family or medical reasons. One qualifying reason to use this is for severe health conditions such as sickle cell, cancer, heart disease, whatever, any health disparity. So for this severe condition, this makes you unable to work. The time the time can be taken off with FMLA all at once. Like you can use this all at once during maternity leave or after a major surgery. You can utilize it in separate blocks for a single time, whatever is beneficial for you for your health. In a way that reduces your weekly, you can use this to reduce your weekly schedule. If your sickle cell is starting to become an issue, you can kind of spread out this FMLA time. In a lot of cases, they are paid for, but in some cases, they are not. But it will secure your job from you losing your job. So severe health conditions most commonly require time off through FMLA, when it would help if you need to stay overnight in the hospital, when you are unable to work for more than 3 days, and then when you have periods of disability and in treatment. So these are the things that you need to be aware of when utilizing FMLA. So as I stated, today was just really just a small overview. The This recording you can go back and watch and take notes. I just wanted to make sure that I at least let the people in my community know what is available out there. Here are some references so you can check out sicklecell.com, Living Workers Health Rights, or you can go to the CDC. There's a tip sheet. They're supporting students with sickle cell disease. And if you are not following our pages, please do so. We're on LinkedIn and Facebook under Scott Center for Observation, Treatment, and Transition. And then we're on Instagram, Scott Center OH, as well as YouTube, Scott Center OH. But if you have any questions for me, you can reach out to me by email or visiting our website at scottcenteroh.org. I will be willing to answer any questions you may have. And I thank you for tuning in today And like I said, once again, this was just an overview. You have any other questions pertaining to school, sickle cell, mental health, any of those things, we are just a phone call away, or like I said, you can visit our website. That is scottcenteroh.org. Thanks for tuning in.